Taylor, welcome. I'm so excited to chat with you today. I talked to everyone in the intro about how we obviously met many moons ago, and I'm so excited to reconnect with you and see what you're up to and pick your brain and wealth of knowledge of everything, especially all about thyroid today.
I'm so glad to be here.
Well, tell everyone a little bit about yourself, what you specialize in, what you love to chat with, the type of patients you work with.
Yep. So I am a board certified functional medicine physician assistant. I previously was a registered dietitian nutritionist who went back to PA school as a second career. So I've been in the functional medicine world a little over a decade and found functional medicine just very early on when I was a dietitian, really with my own health struggles. And then honestly, just wanting to be able to use food as medicine to help people heal. And that unfortunately wasn't what I was learning in RD school. So after school was really when I hit the ground running with certification after certification and my own research in integrative and functional medicine. So currently I am practicing. My practice is in Northwest Arkansas, but I see patients in the states of Arkansas, Texas, and Oklahoma. My practice is called Whole Wellness, and I see adults. I specialize, or I see adults all over the board, but I'm most passionate, I would say, about, of course, gut, GI disorders, gut health, thyroid disorders, autoimmune disease, hormone imbalance, and fertility. So that's kind of where I have found my niche.
Yeah. And I mean, everything that you just listed, obviously the whole body is connected, but all those things are so interconnected.
Yep.
So have been struggling with any of those, this episode is definitely for you. And we're going to do an emphasis, obviously, on thyroid, but we can't do that without talking about hormone imbalances, infertility, gut health for sure, nutrition, all the things. So tell our listeners a little bit more. I think the thyroid's really still very misunderstood across the board, but especially by consumers and patients. So if you could talk to us about what is the thyroid's function in the body, the biggest roles we sort of can infer, and then what that should really mean. Like, when is it time for them to think about getting it checked? All of that.
Great. Yep. So our thyroid, for those of you who don't know, our thyroid is an endocrine gland and it's a butterfly gland kind of located in the neck, just below the Adam's apple. And it produces thyroid hormone that regulate many things in the body, many, many things. So that would include our metabolism, our energy production, growth and development, our digestive function, brain development. It even has control over our immune system, bone health, heart and muscle contraction, temperature, and our sex hormones. And of course, fertility goes along with that too, right? So it's kind of that master gland that's really, really, really important. Now, hypothyroidism or low thyroid, underactive thyroid is when the thyroid is not functioning appropriately and making enough thyroid hormone. Symptoms could include fatigue, weight gain or trouble losing weight, cold intolerance, so being cold all the time, always having to wear a jacket when everyone's in short sleeve or t-shirts, dry skin, brittle nails and brittle hair loss, constipation. I sometimes see muscle cramps, joint pains, definite hormone period menstruation irregularities like irregular periods or excessive menstrual bleeding. Sometimes brain fog, problems with memory, problems with concentration, puffiness, definitely like puffy face, loss of the outer third of the eyebrow, which I feel like always kind of shocks people. And people are like, oh, I have to draw in my eyebrow, enlargement or scalloping of the tongue. So I always try to look at my patients' tongues and kind of see what's going on there. And it has been associated with depression, anxiety, and high cholesterol as well. So, that's a huge list, right? And there's a lot of root causes of a lot of those symptoms. But if, you have a lot of those symptoms, it definitely would be good to be screened. And then to take it, one step further, I know we'll talk about this a little more. Hashimoto's is an autoimmune. First of all, it's the most common cause of hypothyroidism in developing countries. And it's not necessarily a problem per se with the thyroid itself, but it is an autoimmune disease. So your body is losing the ability to differentiate between self versus non-self and is attacking your own thyroid gland. And long-term, that damages the thyroid gland. We produce less thyroid hormone. So that is the most common cause. So, and I know we're going to talk about labs here in a little bit. So I do always screen with antibodies to see, well, what's going on? You know, is this just hypothyroidism due to some other cause, or is this an autoimmune condition? Because I do treat them a little bit differently. So that's a little fast and furious rundown of the thyroid and specifically hypothyroidism.
Yeah, there's so many conditions and symptoms that people can be checking off and sort of get brushed off. So if you have no known cause, you've seen your PCP or your specialist for so many different things, getting a full thyroid panel, which I want to talk about, is very, very important. And also, just to reiterate and kind of, piggyback on what Taylor was saying is, the autoimmune differentiation, which we can talk way more about this, but it's really right. We're saying it's not a thyroid problem. It's an autoimmune problem that becomes a thyroid problem as well, right? When the thyrocytes get so destructed over time that you do start having an actual thyroid hormone deficiency. So they're definitely both, they can be addressed similarly in many ways, but you also have a different approach at the same time when you differentiate the autoimmune process around it. So I find I have my own little analogy that I have created for GHT that we talk about with all of our patients or in our ebooks and guides and all of these different things about thyroid markers that we're going to talk about for labs and making it a little bit more digestible for people. But I would love to hear how you sort of walk through what we're talking about, a full thyroid panel with your clients, like what that is, why those markers are important and what they sort of mean, big picture.
Absolutely. So I think the first biggest clinical pearl of this is you have to get a full thyroid panel to assess your thyroid function. TSH is not usually enough. Now it can pick up sometimes. I'm not saying that it's a useless marker. It's part of the panel, but it's not enough for a full assessment. So when I test a patient or I'm screening someone, or even if I'm testing them on medication to see how their medication is, how the dosage is for them, I'm looking at TSH, thyroid stimulating hormones. I'm looking at free T4, free T3, reverse T3, and then thyroglobulin and thyroid peroxidase antibodies. So kind of just what I was talking about, unfortunately, most practitioners just check a TSH. I mean, that's what I was taught in PA school. Like that's what medical schools are teaching. So I always, not to get on my soapbox, but I'm like, it goes back to learning in schools on how to check a full thyroid panel. So, and insurance plays into that too. That's a whole other side of the game. But TSH is actually produced in our pituitary. It's not a thyroid hormone, right? So it's looking at, it's an indication of like what our pituitary gland is doing based on our thyroid function feedback loop, rather than how the thyroid's actually functioning. When TSH is high, yes, it can mean someone is underproducing thyroid hormone, because basically they're low thyroid, the body's getting the signal and the feedback loop to say, hey, produce more TSH, we need more thyroid hormone. So it's kind of opposite. It's confusing to people, I feel like. And then on the other side, when TSH is low, it could correlate with hyperthyroid or overactive thyroidism. Sometimes someone being on too much medication, thyroid medication, sometimes timing of the test with the thyroid meds, and sometimes it can just be a little innately suppressed with thyroid medication. So TSH can give some insight. Again, not a useless marker, but it's not the full picture. So how I like to explain this to people is TSH from our pituitary gland, again, goes down to our thyroid to tell our thyroid to produce T4, or free T4 is our active T4 in our body. And then that goes to our tissues, especially our liver, to produce one of two things, free T3 or reverse T3. I like to call free T3 our gas pedal. So everything we kind of just talked about the thyroid's function in doing, that's what's going to help with metabolism, energy production, immune function, bowel regularity, hormone balance, etc. And then reverse T3 is like our parking brake. So it kind of puts everything to halt. So that's why it's important to look at the full picture, because you might have normal TSH, and I do want to touch on normal versus reference ranges, because that matters too, right? You could have a normal TSH, maybe a low free T4, free T3. That could indicate, of course, suboptimal thyroid hormone production or a conversion issue. On the other hand, you could have over conversion of reverse T3, that parking brake, putting everything to halt, and lower free T3, due to different things we can always talk about too, definitely like stress, infection, etc. That you could be converting just the wrong way, basically. So that's why that is important. The other thing I wanted to talk about is kind of second clinical pearl is your normal versus optimal reference ranges on labs. Because, I think the TSH reference range on most labs goes up to 5. I believe it's like 0.5 to 5. Well, for me, that is not optimal for my patients. So we know that lab reference ranges were developed, maybe not always like a normal healthy population. And then things weren't taken into account when they developed them, like health status and stage of life, were they on medication, etc. So we don't know about that. So where I like thyroid labs is TSH, I like 0.5 to 2, but I always tell people I'm looking at the whole picture before I jump the gun. If you're at 2.3, I'm not going to lose sleep if our other levels are optimal. So we don't want to get too caught up in that, but 0.5 to 2-ish. Free T4, I like 1.1 to 1.4, give or take again. And also I'm always looking clinically and looking at their symptoms. I'm never just treating on a lab. Free T3, I like 3.2 to 4-ish. And then reverse T3, I like less than 12. So that's what I'm liking. And like I said, those are different. If you look on your basic labs, that's different than the reference range on the labs. So I think that's important is to get the full thyroid panel. And like I said, I do like to screen for antibodies, especially if I do know they're hypothyroid. And I can't tell you how many times I get a new patient that has been on thyroid medication for many years and no one's ever checked their antibodies. So we don't even know. I'll ask them, do you know if you have Hashimoto's? And they're like, what? I haven't even heard of that, and it's an easy test to get and screen for. And again, like I said, a lot of the treatment is similar, but we take a little bit of a different approach too. And then secondly is we want to look at more optimal reference ranges versus just the reference range on the labs. And again, it's hard because back in medical PA, NP school, etc., we don't learn those, so it starts there. So it's not necessarily your doctor's fault. They look at your labs and they're like, oh, a TSH of 4.5, you're normal, So anyway, I would say those are kind of the two biggest clinical pearls I would say take away with labs, and then getting a full thyroid and trying to look at more optimal versus normal reference ranges.
Yeah, I love that. And a few comments you mentioned, but I want to reiterate when it comes to thyroid testing. It drives me crazy when we are so resistant as practitioners to test people's antibodies, because first of all, it can take 7 to 10 years for those to even populate in an individual who has that genetic predisposition. But those can populate far before you start to get the detrimental effect on the thyroid hormone production. So we're just sitting here testing like TSH, maybe T4 if you're lucky, and we're not actually testing antibodies that are then showing that response that might cause that degradation to the thyroid gland itself. So advocate the best you can, work with your practitioners. If you're working with like a functional nutritionist, even that is like suggesting ways to advocate with your PCP or your endocrinologist to get those labs and why. If you can kind of talk the talk, it at least gives you kind of like better headway on getting the labs ordered. The other one I want to mention, because I feel like this is talked a lot on the social media sphere and we don't always say why, total hormones versus free hormones. So Taylor was mentioning getting your free hormones checked, which 100%, but just knowing that total doesn't always indicate how much is bioavailable for your body to use. So free hormones are things that are not bound to proteins and actually can be, adhere to hormone receptors and be used by the body. So you can usually tell in your lab markers, right? If something says free hormone next to it or total. If it doesn't say free, it's likely the total that they're checking. So I did want to reiterate that there's very much a difference there. And if we're not checking free, it's really important. Like the total hormone is of T4 is what actually impacts our TSH. So those two have that direct relationship, but we're not actually checking downstream what the body is doing, right?
Absolutely.
I think that's really, really important. Do you find with your patients who, let's say, are either not symptomatic yet they have their antibodies are starting to peak, even if they're, let's say like their TPO is only like 37, right? Mm-hmm. And it's really low and they're like, how worried should I be? We talk about antibody levels if you want, but, how worried should be? I feel fine. Or, my TSH is 4.9, I don't know, 4.9, and I'm having all the symptoms. My doctor says I'm fine. do you find it's hard to get like patient buy-in? Where are you at with that in terms of like committing to their health and protocols and programs and all of that?
So I would say no, but I usually get patients who have seen a lot of other docs and are like, I'm not feeling good, help, so I'm not normally, I have a few people that come to me and are like, I just want to optimize or I kind of want to biohack, but I get a lot of people that are already very well aware and that are already wanting a full thyroid panel and wanting to know what this means. So, but how I explain this in one sense, and like I said, I always, on every new patient that I have, I check a full thyroid panel with thyroid antibodies. I just do it. It will surprise me because I don't want to say it's often, but sometimes I do see a beautiful looking thyroid panel, optimal ranges, but thyroid antibodies that are positive. And how I tell the patient, and I never want to freak anyone out because we know the stress can affect our thyroid as well as everything else. But I tell the patient, we're catching this really early, basically, right? So we know that your body is attacking your thyroid gland. And this is where functional medicine shines because we can reverse these thyroid antibodies. And I've seen that over and over and over again, especially if they're not very high, and especially if they haven't damaged the thyroid gland very much. And like I said, and so we're catching it early. It's great the thyroid panel is normal. We keep monitoring that. We make sure it stays optimal, right? Now, people with thyroid antibodies may have damaged their thyroid gland long term, may have to be on medication, possibly. But like I said, we can reverse that. And the earlier we can catch it, the easier it is to reverse it and reverse that damage. And so, like I said, this is where functional medicine shines because conventionally, A, they're probably never checking thyroid antibodies to begin with, right? But B, the treatment doesn't change. If you have low thyroid, and this is why, and this is how I explain it to my patients, you come into your primary care doctor, you have symptoms, they check your TSH, it's high, they slap you on Synthroid, send you out the door. To them, the thyroid antibodies don't really matter because it's not going to change their treatment, right?
I often tell you that they're not going to go down. Like once
they're exactly.
Yeah.
Right. They're not going to go down. It's not going to change their treatment. You're going to be on Synthroid rest of your life. There you go. Right. But from a functional medicine standpoint, it matters. We can, and we'll talk about this a little bit later probably, but, treat the gut, work on lowering toxins, addressing the stress, optimizing your nutrients, just definitely healthy diet and lifestyle interventions. That, like I said, can reverse that attack. So there is hope. But like I said, I just do monitor that. The other thing I do mention to patients with the importance of checking thyroid antibodies and the importance of intervention is that we do know when you have one autoimmune disease, you're more likely to acquire another. So in the whole scheme of things, is Hashimoto's a huge deal? Maybe to some people, maybe not, but we want to develop, prevent the development of rheumatoid arthritis, lupus, Sjogren's, scleroderma, things like that. So, it's more of a preventative. And I will say most people are really happy when you say, we can reverse this. We can work on your immune system, and then be understanding they want to be preventative. They don't want further destruction of their thyroid gland or development of further autoimmunity.
Yeah. Yep, exactly. And a couple other things to piggyback on that one is, first of all, I do highly recommend if you are getting you found a functional provider, right? You work with Taylor, whoever it is, and you do a full panel for the first time and antibodies are high. I always recommend repeat testing. I always recommend it if it's the first time that they are elevated or if they're slightly elevated, because labs aren't always right. They just aren't always right. I see all the time. I've had it happen to myself where they're slightly elevated, repeat a week later, and it's completely negative. So I do recommend that. Obviously, if this is like your third, fourth panel and they're elevated, like that's where you're at. And that's a different kind of concept. I do want to talk in terms of, obviously, we said repeat testing, but how often do you recommend people get their thyroid tested?
Oh, good question. And also to piggyback on that, I always confirm via ultrasound.
Yeah.
Too. So just FYI, you have thyroid antibodies positive, repeat testing is positive, or they're very positive. I always order a thyroid ultrasound to see what's going on with the thyroid gland and see if it's correlating with Hashis. How often, you said, for thyroid hormone? So it depends. I guess the first scenario is someone's not on thyroid medication, right? And if their levels were suboptimal and we're doing more of a natural kind of functional medicine root cause approach, no medications, I'm probably going to retest in about 3 months. If they're on thyroid medication and I'm adjusting medication, I have labs done 4 to 6 weeks after I adjust the dose. And then once they're stable, I at least check twice a year. Thyroid antibodies can take a little longer to drop, so I'm not checking those every 4 to 6 weeks personally. I'm checking those maybe every 3 months or a couple times a year.
Yeah, I like that. And if you're someone who has a normal panel getting it checked, how often would you recommend that they get it checked? Because a lot of people will say, right, it was normal, I don't need it repeated.
So if it was optimal, not just normal, optimal, I'd say once a year, unless you're starting to have symptoms of hypothyroidism, I think would be a good screen.
Yeah, I agree with all of that. I have a question I wasn't going to ask, but now I do.
Yeah,
Obviously I get this all the time, but I've been having it much more frequently in my clinic is, so individuals who, it's kind of funny when the process of events here in traditional care, but that have had thyroid ultrasounds done, found nodules and or goiters, but their thyroid labs are, well, quote unquote, normal, right? Like they're not having elevated antibodies or they're not being checked. What words do you have to offer to an individual that's had an ultrasound and has nodules?
Ooh,
And that's
really good.
but obviously just like basics of like, how should they approach it from like a stance of wellness, if you will?
Yeah, absolutely. So I think obviously monitoring, I'm referring out to endocrinology at that point. I'm not an endocrinologist, even though I do more functional endocrinology. Is it a concerning nodule that needs biopsied, right? So I would defer to endo and their recommendations on that. And then we can do things to help with that. Now, is their nodule due to them being kind of hypothyroid? Maybe labs aren't optimal. Is it, with iodine status, too much, too little, etc.? So I'm kind of doing a deeper dive into potentially what's going on, why, and then obviously we want to be working with endocrinology to make sure it's not something we need to be concerned about that needs to be biopsied or monitored.
And then they biopsy and it's benign. Do you approach it from more of an autoimmune standpoint and wondering if it's that, kind of what's lurking underneath, or do you
I guess it depends. A lot of times I do check thyroid antibodies, and sometimes I check other thyroid antibodies as well, like TSI and TRAB antibodies, to kind of rule that out. I'm looking at an ANA too. I'm looking at the whole clinical picture. So yes, that is one thing that I do rule out with the nodules.
And so we've kind of been alluding to this in many different ways now, but people are probably like, okay, but why is the thyroid the root cause, or what's the root cause of my thyroid disorder or my Hashimoto's or Graves' disease, which is the hyperthyroid kind of version of autoimmunity. So what are some of the big overarching themes you see with thyroid conditions that you would want them to talk to their practitioners about?
Yep, absolutely. So the thyroid gland is a very sensitive gland. It can be affected by many things. And I feel like that's probably why a lot of people have issues with their thyroid. I'm going to kind of differentiate this in 2 ways just a little bit. So first of all, let's talk about Hashimoto's. So again, it's first an immune system issue that then damages the thyroid gland, leading to hypothyroidism or low thyroid, but it's that autoimmune disease. And when we think of root causes of autoimmune disease, we know there's 3 things that need to occur for an autoimmune disease to develop. First, we have a genetic predisposition. Most of us probably do, right? Second, we have some kind of trigger. That trigger can be like a major trauma or a major illness or nutrient deficiencies, very poor diet, toxin exposure, even pregnancy though, can be. And again, it's such a blessing, obviously, but it's a stressor on the body, right? And then we have increased intestinal hyperpermeability. And so when we're thinking of a root cause standpoint, I'm thinking of, okay, we can't change our genetics. I'm always listening to my patient, their story. I'm looking for triggers. And then also I'm looking at their gut, always, always, always. And, when we think of root causes of leaky gut term, but increased intestinal permeability, right? We're thinking poor diet, alcohol exposure, antibiotics, acid suppressing medications, birth control pills, nutrient deficiencies, traumatic brain injuries, food poisoning, low stomach acid, poor digestion. Usually that can be due to like stress response, being in fight or flight too often. which goes into like high cortisol, stress, environmental. We're thinking like glyphosate, Roundup, BPA, heavy metal exposure, chronic inflammation, which obviously will have other root causes, bacterial, parasites, viral, candida infections, gluten consumption, and then overtraining and overexercising, which I think people don't think about often. So from a root cause standpoint, like I said, for me, that's why it's important to check antibodies, because I'm like, is this autoimmune? Is it not autoimmune? Kind of differentiates my root cause. Now, on the other side of the spectrum too, obviously those things can also cause just innate hypothyroidism, without having autoimmune or Hashimoto's. But also some other things can just play into just suppressing the thyroid in itself. That could be, like I said, I already said nutrient deficiencies, but like inadequate protein intake. Actually, too, we need tyrosine for our thyroid to function appropriately. Too much fluoride, excessive fluoride exposure, too many goitrogens. It's another controversial topic, but too many goitrogens or drinking tons of just green juice all the time, right? Too high or too low iodine, and that's again more controversial. And then not eating enough calories too is a stress on the body, right? And so those are all things I'm uncovering. I'm always looking at the gut. I'm always looking at nutrients. We're never going to be perfect, but I try to lower toxins. We really want to prioritize lifestyle, stress. Do you have meaning and purpose? Do you have joy? Are you laughing? Do you have good community around you? Those things are really important in looking more what can balance out the thyroid, optimize the thyroid naturally, but also what may cause the issue in the first place.
Yeah. And so if I was a patient, which I guess I am, if I was a patient, super overwhelmed, right? I'd be like, wow, so you just listed everything ever, which is, well, we can pull research on all of those. Yep. These are big contributors. Mm-hmm. So they're like, what do I do? It sounds like I'm like, damned if I do, damned if I don't. Now what? Like, where do I start? And I will say my first thing to say will be, this is why we highly recommend not trying to do everything on your own. People try to treat and heal themselves, which is great. Like the commitment to that and, dedication is amazing, but that's why working with a trained professional is so important to help you navigate the chaotic world of the body and the thyroid. So I will say that first and foremost is they can really hear your story and say, it really sounds like we need like a mycotoxin test versus we need to do, I don't know, like testing you for gluten sensitive. I don't know. I'm just throwing things out there. Gluten sensitivity, different things like that. So how do you, for lack of better words, like dumb it down for your patients so they're not like, holy cow.
So the first thing I always tell people is like their job is to implement stress management. And my job is to take and like help with their health and figure out these root causes, first of all, because, and I feel for people because there needs to be more functional medicine providers. It needs to be more accessible to the public. It does, because people are having to do it themselves because they're not getting the answers that they want from their primary care doctor, endocrinologist, et cetera. So I totally understand. But I have to tell people, I have to shoot them straight. I'm like, let me figure this out for you. Okay. Yeah. First of all,
your job is the detective and the corrector of, while they obviously have to put the work in, but you're there to guide it.
Exactly. And I always tell them too, and this could be about, anything we think of, but especially when we think of like toxins, we can't live in a bubble. There's toxins all around us, same with like EMFs, and there's mold everywhere, so I have to sometimes shoot people straight and say, you stressing out about this may be more damaging to this blank exposure you're getting. Now, there's a time and a place that people can be very sensitive or be exposed to really dangerous mycotoxins. I'm not saying that, but, that's where it reiterates. And I was going to talk about this later, but our adrenals affect our thyroid, which affects our sex hormones, right? And so we have to go back to supporting the stress response. Unfortunately, we live in this day and age where there's always the pressure to do more, be more, fill every second of your day, have little margin, dedicate to too many things. And it's very sad to me because I feel like, culture needs to shift, and we need to have margin. We need to focus on our nervous system. We have to have downtime. We have to rest well. We have to have times of stillness. And it's very countercultural now, which is really, really sad to me. And it's hard. And everyone's in different seasons. You have a mom of 3 and her schedule is just crazy. And she might even be working on top of that. Like, I'm not saying that she has to figure out how she can meditate for 20 minutes a day. That's not what I'm saying. But we have to do the best we can to support our nervous system, support our stress response, let go of what we can let go of. And that's really, really foundational, I feel like, to health and healing. So I'd say start with the basics, the foundations, the stress response, the getting outside, getting sunlight, having community, having, trying to have good joy and laugh and things like that. And then, of course, if you can work with a functional medicine provider, that's where we can uncover what's going on with your gut. Are there things we need to further work up and test? What's some general nutrient support? Are you deficient in specific nutrients? That's where I would start. Now, if someone can't work with a functional medicine provider, they could do some of these things themselves. Like, they could do some general good gut support with some probiotics, and then probiotic rich foods and fermented foods is tolerated, and good fiber in their diet. And they can do some general nutrient support in foods that the thyroid needs to function. So that's where I would start, is with the basics. And if you can work with a health provider, awesome. If not, I would say one thing at a time. And I always prioritize the diet, lifestyle stuff first, and stress beyond anything else.
Yeah. And it's sort of like this obnoxious catch-22 of like, there's this whole, pile of people that are like, all lifestyle, I can correct all this by just going like gluten-free or AIP or doing all of these things. And then sometimes, and oftentimes, like when they're in that position or like really so far into not wellness, that it's not enough. They do need that testing or whatever it is to kind of dig in, because the lifestyle piece just is enough, or the lifestyle piece that you're following might not be the appropriate one for you. And then there's like this whole other grouping of people where it is very lifestyle driven. It is very foundational, but that's not sexy. So they don't want to follow it. And they're like, stop talking to me about stress and gluten, because like, I want to do the mold test. And you're like, you're not the person that needs the mold test. You're the person that needs the grounding and like the calming and the nervous system regulation. So it is hard, and like kind of figuring out which one your patient is or which one you are as a patient can be frustrating, I think. But
oh my gosh, yes.
Obviously the lifestyle and nutrition is the most important part, but sometimes it's also not enough, in my opinion.
Yep. No, I completely agree. I've seen patients on one side of the spectrum. We've literally fixed their diet, worked on their stress, got them moving daily, got them to get some sunshine and some full spectrum light, and they're better and they're out the door and they need me when they need me. But there's other people that do need a deeper dive. And I always tell them that those things are still foundational, but when they're not completely correcting and optimizing what we're concerned about, there's something deeper, and we need to just peel back the layers one by one.
Yeah, it's a lot. And that's why I'm absolutely working with someone one-on-one who has experience is really, really valuable. So, and talk to a big topic, right? We can talk more about the gut too, but I think we're the Gut Honest Truth podcast. We talk about the gut all the time. Talk to me a little bit about like different conditions, especially hormone conditions, and especially females, that really could be connected or contributed to root cause of thyroid, and what's the best like mode of action and like approach there.
Yep, absolutely. So again, kind of what I had mentioned before is when we're kind of taking a more upstream root cause approach and we're looking at that hierarchy, we're thinking adrenals, which produce cortisol, stress hormone, etc. That affects thyroid gland, which then thyroid hormone affects our sex hormones. So if there's adrenal dysfunction or a dysfunctional circadian rhythm, cortisol production, etc., that can cause thyroid hormone dysfunction, and then that causes hormonal dysfunction. When I'm thinking of hypothyroidism, I tend to see it with estrogen dominance a lot. And so when we think of estrogen dominance, we're thinking like heavy menstruation, PMS, tender breasts, low libido, weight gain, trouble losing weight, that kind of thing, clotting, menstrual periods of clotting. Definitely fertility issues, very, very important. And then also a correlation between some of my PCOS patients. With PCOS, I was actually trying to research this a little bit. I have seen a correlation, but I don't think a causation is known. So I don't think it's necessarily thyroid dysfunction can cause PCOS, but it can cause ovarian dysfunction and ovarian cysts. So that for sure is a big one. You know, with estrogen, the thyroid affects estrogen, and then estrogen then affects the thyroid. So it's a very interesting kind of hamster wheel there where, you know, estrogen must be broken down and excreted by the body, broken down by the liver. And then hypothyroidism can kind of slow this metabolism of estrogen and then maybe lead up to more of a buildup or kind of estrogen dominance, buildup of estrogen. And then on the other hand, you know, high levels of estrogen will signal the liver to increase something called thyroid binding globulin, which is an inhibitor protein, binds to thyroid hormone, reduces amount of bioavailable or free T3, free T4. And then so therefore, you know, too much thyroid binding globulin can cause low thyroid, of course, or hypothyroidism. So it's kind of a twofold thing of like, which came first, chicken or the egg? But thyroid affects estrogen, could lead to estrogen dominance, and then too much estrogen then affects your thyroid function. And we see that with birth control pills, right, too. And then, you know, the other thing that's important is like its effect on something called prolactin. So, you know, hypothyroidism can increase levels kind of going upstream of TRH, and then that goes down to stimulate TSH, which then also produce more prolactin. And then when there's high prolactin in the body, this shuts down the production of something called luteinizing hormone, which lowers progesterone. So we're thinking again, estrogen dominance, low progesterone, which could also then play into, you know, fertility, really important for fertility as well. So those are kind of the big things. Again, when we're thinking upstream, I always treat thyroid before I treat hormones. Personally, I do. Now, there's a time and a place where you need some kind of hormone balancing changes initially if someone's having really bad issues, but I always make sure the thyroid is optimal.
Yeah. And one thing that I think is so important, you mentioned obviously infertility problems.
Mm-hmm.
Like how often are you seeing patients come to you that have years of infertility issues or miscarriages and are not being checked for thyroid problems?
Depends. If they're working with a fertility specialist, usually they'll get at least screened. I wouldn't say it's a full panel. I would say it's probably a TSH and a free T4. Yeah. So not perfect, right? Yeah. But I would say, you know, otherwise probably slim, which is so sad because like I said, it's so important. It plays into progesterone production, which of course, and just hormones in general, you know, helps us to make sure we're ovulating each month so that we can conceive. And then obviously we need progesterone for implantation and maintaining the pregnancy. So it is hands down one of the first things I do is make sure you do a full thyroid panel.
It's so wild for such just a disheartening experience that lasts years for couples and females that like such an easy test to order. You know what I mean? That we could be just doing so much more. So if you've been struggling with infertility issues or having, you know, miscarriage after miscarriage, first of all, our hearts go out to you. But like, if your practitioner isn't ordering it, I assure you there's a practitioner that will. So I highly recommend, obviously, if you are in one of the states Taylor is seeing people, like reach out because it is a quick turnaround test that you can order and get answers and support that could be life-changing for all of you.
Oh my gosh, absolutely. And some people, I work with a lot of fertility patients and the causes are very different patient to patient. But like I said, I'm always ruling out thyroid, of course. And some people, I mean, I had a patient that oh my goodness, she struggled with infertility for many years. She was, when she came to see me, she was undergoing IVF and had multiple failed IVF cycles. And we checked her thyroid and this is also very individualized. It's not for everyone, but I did start her on thyroid medication. She did have Hashimoto's and she actually ended up getting pregnant naturally right before she was about to transfer, which was amazing. Now there's a lot of other stuff we did. We worked on blood sugar, inflammation, gut, etc. But that was part of the picture for her. And you know, it makes me so mad and frustrated. It's like, it's an easy test, just order it, optimize it. And I will say some fertility specialists have become a lot more knowledgeable with thyroid and they do want they're usually just looking at TSH, but they want it more optimal range versus normal range, right? So I will give them that because they realize how important it is.
Yep. It is very frustrating. I see it quite often. I'm like, how has no one checked this on this journey? Like, let's take 5 minutes to at least rule something, a big thing in or out, right? So yeah, it's really important, guys. So give us some well, a couple gut conditions would be nice to name. So like if people have been struggling with XYZ or been diagnosed with XYZ in the gut, obviously we know chicken or the egg with gut thyroid is like the biggest conundrum in the body, period. But that maybe they should wonder about getting their thyroid checked or vice versa.
For sure, anyone suffering from constipation, absolutely. I would back that with SIBO, especially if it's a motility disorder issue or anything in regards to gut motility. You're so right, because gut dysbiosis, I feel like, or can be linked to issues with the thyroid. But then, like I said, again, kind of with the estrogen thing, thyroid disorders exacerbate the gut issues. So I would say, honestly, anyone with gut issues, but especially with more constipation, slow motility, even bloating, digestive issues, etc.
Yeah, if you have SIBO, small intestinal bacterial overgrowth, and it is not clearing and you keep doing antimicrobial treatments, like stop doing antimicrobial treatments, take a moment and check out the thyroid, because over 50% of individuals that have thyroid dysfunction are going to have SIBO and vice versa. So highly recommend it, because I always tell people, I'm like, when I was first in the functional medicine space, I feel like I was always trained, like everyone is like, fix the gut and you fix everything. And it's like, no, no, especially when it comes to the thyroid, it's like those two things, it usually needs to be supported at the same time, or you're going to have a really hard time fixing your gut.
Yep. And that's why in an ideal world, I'm looking at all that initially. I'm looking at some good labs that have a full thyroid panel, right? And then I'm looking at the gut microbiome, or I'm at least supporting it, too. So I'm doing kind of both up front, because we don't know chicken or the egg, or do they both affect both? And we both need, we need to optimize both at the same time. Absolutely. But I have seen that specifically as I had just had a patient last week that she had been working with GI, and they were treating SIBO, was not getting better, relapsing, everything like that. And, her thyroid's suboptimal, and no one even looked, or no one would even run a full thyroid panel on her. And I'm like, oh my goodness.
I know the SIBO patients, it always kills me. I'm like, when they just they're like, I've been trying to clear it for a year and a half. There's a bigger picture going on here. And and it's not always just thyroid, obviously, but like if those aren't being addressed, you're going to have a really hard, long time. It's going to get very frustrating for your practitioner and for you. And that's not fair to you. So talk to us some like base recommendations you maybe have for thyroid patients. Obviously, we know it's obviously very individualized, and it matters if it's Hashimoto's, it matters if it's Graves', all these things, but that you can offer everyone like across the board that they talk to their practitioners about.
First, get a full thyroid panel if you can. Obviously it would be great to work with a thyroid literate practitioner that of course could run those, but then also would know what to do intervention wise. Now there's kind of easy access to cash pay, self-pay labs too, which I think knowledge is power to some extent. If someone can't work with a practitioner, or say their practitioner won't want to run a full thyroid panel on them, that could be a potential option, is like a cash pay direct to patient lab. So full thyroid panel, look at optimal ranges. Say someone does have thyroid dysfunction, hypothyroidism, either Hashimoto's or just general hypothyroidism, no antibodies. If anyone follows me on Instagram, I'm like such a fan of the foundations. And I'm always like, because you kind of mentioned this earlier, I think some people, or sometimes even practitioners, I feel like practitioners might be the worst about this. We want to look for the fancy thing. We want to do the fancy testing. We want to do the fancy treatment. We want to dig really deep. And it should be kind of like an onion. We're just peeling back layer by layer. But we have to prioritize the foundations. And I feel like sometimes that gets missed, or we're not prioritizing them enough. So what I mean by that are, clean water. So filtered water, at least half your body weight in half your body weight in pounds and ounces per day of water. Moving daily, one of the best ways to move our lymphatics that helps with immune system detoxification, et cetera, is just moving. So, get up every hour and move. I was actually listening to a podcast the other day, and I really enjoyed it. And she was like, get up every hour and dance for 5 minutes. And so I was like, I need to do that in between patients. So movement, daily movement, but not overtraining. And there's a very happy medium, because if we overtrain, we're really stressing out the body. That then can affect thyroid hormones, et cetera. I always tell people, and I always have people listen to their bodies. There's never a perfect recommendation. You can't do this and you should do this, right? You should never do Orange Theory, but whatever, CrossFit, et cetera. I think it's very individualized, and I always have people listen to their body. And I always ask people, okay, so after you do blank class, how are you recovering? How do you feel the next day? If you are just, I'm totally shot, I'm tired, I'm super foggy brain the next day, you've overdone it. Same with like sauna and stuff too. So, low and slow, listen to your body with that. Sunlight, full spectrum light exposure. Again, back to the adrenals, we need to have healthy cortisol production at the right time. Same with melatonin. So, getting some full spectrum light first thing in the morning and maybe a little bit in the afternoon, getting some sunshine for the vitamin D. Super important. Sleep hygiene. So, I talk to my patients, I like to call it parenting your phone. So, in an ideal world with sleep, we are disconnecting an hour or so before bed. We're not exposed to blue light. We're winding down, dimming the lights, maybe taking a hot Epsom salt bath, and we're preparing our body for rest. Now, that's optimal, but I always am very real with my patients too. And I'm like, there's a happy medium. I know not every night you might do that. And there might be some nights you want to watch a Netflix show or watch a movie with your, spouse or roommate or whatever. And so at a minimum, we're getting some amber blue blocking glasses. We're wearing at least an hour before bed, and we're trying to be intentional about decreasing screens or not doing anything too stimulating before bed, like answering emails and things like that. And then, of course, like I said, stress management, and that's very individualized stress management, nervous system work. So again, for some people that is like prayer, meditation, silence and solitude, get out on a walk. But I would urge people, like, go out on a walk without your phone, and then deep breath work. Like, I love deep belly breathing. That's really easy. And I tell people, because I think the biggest hiccup is time. Like, I don't have time for blank. And I said, you can literally put your hands on your belly and do 3 big deep belly breaths once a day. Like, that's better than nothing. Or maybe twice a day. Maybe it's before you go into the office or after you drop your kids off at school or whatever. So very reasonable and realistic things. And then, just to touch on like a couple more things, diet, anti-inflammatory, colorful diet, variety, diversity, gut healing nutrients. Balancing your blood sugar is really important, because if our blood sugar is really erratic, that's also going to play into thyroid, inflammation, etc. And then, like I mentioned before, which is really important, and I see this especially, I feel like definitely during the pandemic area, but community, people, having meaningful relationships, having meaning and purpose in your life, those things really do matter. And, I don't feel like it gets talked about that much either. And there's a time and a place for gut treatments. There's a time and a place for supplements. There's a time and a place for medications, et cetera. But those are the foundational things that we have to make sure we're doing, because on the other side of the spectrum, I've worked with patients and I've been in this field long enough to see that sometimes there's people who do all the fancy things or all the treatments, but they're not addressing the foundations. And those people either get better for a little bit and relapse, or they don't get better because we're not addressing the foundation. So, and again, just like we said earlier, there's more layers to some people. If people are already doing all that and they're like, but I'm already doing all the things and I'm not better, there's something else going on, work with the practitioner. There's another layer that needs to be pulled back. But we do need to make sure we are prioritizing those things to the best of our ability.
Yeah. And I love that. And I love, it's not that often, I feel like, anymore in the functional space that I come across people who are much more realistic and sort of like, let's meet you sort of where you're at. These are some maybe non-negotiables or things I highly recommend, but it is which gives functional medicine a bad rap these days. It's like there's people who are so extreme that I can't even it makes me less and less extreme like every day as a practitioner. Yeah. But I love that. It's like those simple things matter, and behavior change is hard, but like working with someone, like you were saying, people, I remember going to IFM all the time and they'd be like, everyone close your eyes and meditate. I'm like, this is not for me, but like being able to do 4-7-8 breathing, whether it's for client care or before eating, like takes 30 seconds, you know what I mean? And it's something that I know works for me and I am willing to commit to. And you just have to find the things that work for you and you're willing to commit to, right? It doesn't have to be huge life-changing things where it's like I journal for 30 minutes a day and I meditate another 30 minutes a day. Like,
and I can't do that. And if I can't do that, how do I expect a patient to do that? And yeah, that's where I'm at.
People, kids and families and like, no, you have to find things that are realistic, regardless of what you prioritize in your life or you find the research about and all of that. Like, if they're not going to do it, it doesn't work. Right.
Exactly. And that's why I'm an investigator, but I'm also making sure I'm listening to the patient because I'm like, okay, tell me about your day. What does your schedule look like? Where can we find margin? Is there anywhere we can say no to? And maybe it's a season they can't, and so we have to be realistic and I always tell people that too. And I had a patient somewhat recently that she was very knowledgeable with functional medicine and like even biohacking and stuff like that. And she was trying to do all the things. She was trying to do red light, vibration plate, sauna, cold plunge, all things. And she was very overwhelmed. She wasn't doing any of it. And she's like, I know all the things, I'm so overwhelmed because I need to do all the things. And I'm like, no, pick one thing. Yeah. One thing. We can't do all the things. We can't. Now, some people, maybe they have more time and they can do all the things. I can't do that, and some days I'm just running from, the morning to the evening, but I still need to create some time to pause. Or maybe for me, like I said, it's getting outside and doing like a light walk in the sunshine or, anyway, but you have to be realistic. And that is one point. All of this, I obviously live and breathe and love functional medicine, but it's very overwhelming. It's very overwhelming to patients. It really is. And so again, never forget the foundations, never forget the basics, do the best you can, prioritize. And like biggest recommendation is like, try to create some margin in your life, whatever it is.
Yeah, I love that. So tell everyone listening, obviously we will post it, but how can they find you? How can they work with you? And if, at minimum, guys, we're going to post and follow her on social media because lots of free information. I've been seeing all the like Q&As you're doing on your stories lately, and I love them. They're super helpful just to have that insight, even for 30 to 60 seconds of your time.
Thank you. Well, I love educating people. And that's one of the things I know not everyone can have access to a functional medicine provider. And again, I'm not providing medical advice, but I can take questions and I can give some insight and just kind of help equip people. And that's one thing I'm really passionate about beyond, helping my patients, seeing my patients. So definitely follow me on Instagram. You can tag it, it's Functional Med PA. My website is mywholewellness.com. You can find information about becoming a patient, my background, what appointments look like, etc. That also links to my Instagram as well. So those would probably be the two best places to find out more information.
Well, I love it. And thank you for taking the time to share your knowledge with everyone today. And I just love catching up with you.
Oh, it's been so great. Thank you for having me.